Live from Toledo, this is 13 ABC Action News.
All right, well, straight ahead, we are talking about your foot and ankle health today on Ask the Expert. Dr. Corey Russell, he is live here as we speak, ready to take your questions. Give him a call, 419-534-5430. Thanks, Ross.
We're talking about your foot health today on Ask the Expert. Dr. Corey Russell's here to take your questions. You can reach him at the number on your screen, 419-534-5430.
9:24 on this Sunday morning. Your foot health is our topic today on Ask the Expert. Dr. Corey Russell joins us live now with answers to your questions. Good morning.
Good morning, Christina.
The first question is from one of our viewers. They think that they have a bunion, so they want to know how they can treat that.
Bunions are a common problem, and we see this in the office obviously all the time. It's when you have that bump on the side of your foot near the big toe. The big toe usually starts to drift over towards the second toe, and usually that bump on the side of the foot causes pain. So treatment consists of padding, wider shoes, that kind of thing. If that doesn't work, which typically doesn't work well, we're looking at a surgical intervention to straighten out that toe and get rid of the bump.
Okay. Another thing that we've talked about in the past before, it's something that a lot of times people notice more during the summertime, is say their toenails kind of thick, yellow. They want to know how they can clear that up or if they can do that on their own.
Well, typically it needs to be addressed by a podiatrist, and they can look at it and diagnose to see if it truly is a nail fungus or some other issue. A nail fungus, obviously a very common problem. A lot of people deal with this issue. Various different treatment options, including topical medications, which we prescribe to the office. There are pills which you treat internally, obviously to treat this issue. And the medication we typically use is Lamisil, which is 1 pill daily for 3 months. That helps to clear it up pretty well. We also have a group of patients that don't really want to do either or are unable to, and we'll see them regularly for trimming of the toenails and debride all that thickened, deformed nail.
Okay. Well, one of our other viewers wrote in and said they've been bothered with the corns and calluses for years, so they want to know if there is any quick fix or something they can do to help them.
There are things they can do at home. Simply using a pumice stone and moisturizing cream on the area will typically keep those corns and calluses comfortable. They can use non-medicated padding. They can modify their shoe wear so it doesn't rub on the toes or the bottom of the foot wherever they're having the issue. Also, insoles in the shoe, especially if they're having calluses on the bottom of the foot, can help to cushion it. If none of those things work or you're still having problems, then I'd probably see a podiatrist. We can certainly get x-rays and see what can be done to address the underlying pathology.
Okay, doctor, here's an interesting one for you. This viewer writes in and says that their toes curl over and hurt in certain shoes. So, I mean, what can they do here besides changing their shoes?
This sounds certainly like hammer toes, which a lot of people have as well, and typically the shoes rub on the top of the toe and they cause the pain. They can cause corns to form, which obviously can be uncomfortable as well. So padding is usually advised. Once again, a pumice stone and moisturizing cream can be used, modifying the shoes like you mentioned. But if none of those things work, typically it's a surgical issue, kind of like the bunion is more commonly a surgical issue, to straighten out those toes.
All right, and we have time for another question here. Another viewer says that the backs of their heels are very tender, especially when they're wearing shoes. So they want to know why they hurt and how it can be treated.
Back of the heel is where the Achilles tendon attaches, so sometimes people will get inflammation where that Achilles tendon attaches on the back of the heel. That certainly can cause pain. Also, just from pressure from shoe wear or when lying in bed or whatnot, pressure to the back of the heel can cause a bursitis, which is like a pocket of inflammatory fluid, which can be very tender and painful. Some people even have a heel spur or some type of bony prominence, which exacerbates the condition as well. Treatment, stretching exercises, ice to the area, anti-inflammatories will typically give them heel lifts. They use some type of padding or sleeve to reduce the friction and pressure, and sometimes a splint helps as well. But the big key to the treatment of this kind of issue is to reduce pressure to the back of the heel to allow that to heal.
All right, thank you, Dr. Corey Russell. Thanks so much for coming in. Have a great Sunday.
Thank you. You too.